So at this point, once we've scanned our patient, we're ready to fill out our order form. So the first top information is the patient information. So last name, first name, age, height, and weight. So height and weight are very important to allow us to determine the thickness and reinforcements needed in using the Evoke knee brace. We then also appreciate if you identify the diagnosis specific to this patient. Then on the other information, we want to have your phone and email. So the professional that has scanned and that has assessed the patient, that way, if there's any discrepancies in the order form or the scan, we're able to quickly contact you and be able to address those issues. We then ask you to enter your billing and shipping address. Your measurements are entered here in the four measurements. So again, the 4 mLs and the 3 circumferences. At that point, we also, when we did the scan, you notice that we asked you to scan the patient with a sleeve. So ideally, you would always want to tick off yes, scanning the patient with a compressive sleeve. Identify if it's a right or a left knee brace, and identify if it's lateral or medial OA that this patient has. If the patient has any ligament condition, please identify it here also in the knee portion. Then identify if the type of daily activities of the patient. So leisure would be your light ADL patients. Light sport would be a patient that has some slight walking for their day-to-day activities, but also might practice some light duty sports like some hiking, some occasional golf or tennis. And then sport physical work will be your patient that have physical work where they actually have a lot of loads that they're using, for example, working in construction, or practice high intensity sports. We then go into the assessment of the knee. So it's important that you assess the position of the knee as we described in the static knee assessment. Does this patient has a varus or a valgus knee position? If they have any hyperextension, please identify it. Again, staying in the parameters identified for the Evoke or Provoke, so below 5 degrees of hyperextension. If the patient has a flexum, so a knee contracture at the knee, please identify that the patient has a flexum and quantify it here in the other portion to identify how many degrees of flexion. That way the modelizers will respect that angle of flexum. We then go into the unloading specifications that you have measured. So do you want the brace to be a medial unloader or a lateral unloader? And how many degrees of medial or lateral unloading specifically do you want for the patient? If you choose to have a neutral brace that will just give ML and AP stability, you tick here neutral, and in the total degrees, you will ask for 0. In the options, the standard or default is 2 posterior straps. You also have the option of having 1 posterior strap, which can be used with very, very short patients. The anterior strap is optional. We suggest you use the anterior strap for patients that have a high BMI with a lot of soft tissue, or using the anterior strap if patients have ligament instability. The default condyle pads are 5 millimeters, but you can also ask for 7 millimeter optional condyle pads for patients that are very bony or have a more sensitive knee joint. And then there are the different color options that you can identify with the femoral portion and tibial portion. When filling out the Provoke order form, the top 4 portions are the same as with the Evoke. So patient information, your professional information, your billing and shipping address. In terms of measurements, so the mLs and circumferences are the same. You want to enter those same measurements. You always want to scan the leg with the sleeve. And you also have the option of scanning of the cast if you are not able to scan that patient. Identify again if it's a right or a left knee, and then the affected ligament or a combined instability or torn meniscus. Also in the assessment, identify the same information as we did in the Evoke. And at this point, you notice that there is no unloading measurements to enter on your order form. We then have the colors that are available for the Provoke and again, the options in terms of the condyle pad, either the 5 millimeter or 7 millimeter.